Hi, my name is Rebecca. I'm one of the pelvic floor therapists here at Solstice. Today I'm going to talk about balloon retraining. So usually we use this in patients who either are constipated and they don't feel the urge that they need to go, even if they have stool in their rectum, it doesn't feel like anything's there, or patients who are hypersensitive. So these patients usually go anywhere from like 4 to 6, maybe more times a day, and they're going like small amounts, but they feel this strong urge that they have to use the bathroom. And so we use this balloon and we inflate it, and this will give us information, and we can use this to kind of either increase that sensitivity if they're not feeling anything, or decrease that sensitivity if they feel like they need to all the time. And so how we do this is, if you look at the pelvic floor and the hips, you have your bladder, you have your uterus, and you have your rectum. So if you were to insert your finger in your rectum, right here, there really shouldn't be stool here throughout the day. It's usually empty, and then what your body does is something called sampling. And so every couple of hours, your body will sample what is up higher, and then we can differentiate based off how much this expands, whether you have gas, whether you have liquid, or whether you have stool. And so ideally people kind of wake up, their colon is more active in the morning, they have breakfast, maybe they work out, they have coffee, that gets the GI system moving, and then your body will sample and it'll feel that it's distended enough that you feel like you have to go to the bathroom, and then you go. But often our patients who, let's say, are constipated, they'll have stool here and they don't feel it. Like, this will be stretched out way more than what it should be, and they're just not getting that urge. So with those patients, what we do is we'll inflate this balloon up until when a patient does finally feel an urge. And let's say it's like 150 cc or 200 cc, we will slowly go down so that they can learn to feel it. Because sometimes it's not so obvious. Some people will feel like kind of a sensation behind their belly button and their back, and so sometimes we need to kind of teach someone like what their body is telling them in terms of cues so that they know when they should be going to the bathroom. So this is empty, and so then what we do is we fill it up with air, so slowly filling up. And so this syringe will add 60 cc of volume, and then you can add more. And so let's say we fill it, make sure I'm doing this right, and then let's say this at 110 is where someone feels it. We really want someone to have a strong urge closer to 100. So we'll bring it here, and then we will slowly empty it. So you have to do it like carefully. So just like empty a little bit, and then here we'll kind of talk them through being able to feel it. Someone who is hypersensitive, let's say this will be inflated to 30 cc, and they are like, I need to go to the bathroom right now. And that's where I'm telling them, first, it's just the balloon, there's nothing actually there, but also that's good to know. And what we'll do is we'll have them engage the pelvic floor, take a couple of deep breaths, and just do that a couple of times to see if that makes the urge go away, and we'll slowly progress. It definitely can take a few sessions, and in the sessions we'll do it a few times. That way a patient will slowly build their way up closer to 90 or 100. And then also during the day, they can start to sense, like, it kind of feels like something's there, but I went over this with the balloon, I went over it with my therapist, this isn't the right urge. And then their body will start actually giving them the right urge when they are full enough. That way we can decrease our bowel movements to be 1 time a day, twice, maybe even 3 times, depending on that person. So that's the balloon. Let me know if you have any questions.